So what are the some common misconceptions people still have about joint replacement surgeries?
Personal growth happens when you are out of your comfort zone.
How can organizations like the British Council support the student pursuing healthcare education abroad?
Creating opportunities in terms of scholarships. They will be able to help you apply for those scholarships
Correct.
because a lot of those education brings in certain financial challenges as well. So if you are able to fund yourself for part of that education, then it takes that kind of financial burden away as well.
How can studying in UK open global career opportunities in healthcare for any kind of student?
As well as the university route of higher education, be it in terms of clinical research, is very structured. But there are a few things that the
Dr. Darshan ji, welcome to the Founder's Dream. How are you, sir?
Namaste, Abhishek ji. Thank you for having me on the show. It's great to be here and thanks for having me.
कैसे चल रही लाइफ सर?
Life is going on good.
Super.
Yes.
है? Any hurdles? Any things you want to share?
I
कि लाइफ ऐसा होता है?
देखिए, हर्डल्स तो हर किसी की लाइफ में होती है एंड लाइफ विदाउट अनसर्टनिटीज एंड हर्डल्स इट्स नॉट कॉल्ड लाइफ. ठीक है, तो वो एक प्रोग्राम की तरह बन जाता है. तो वेरेवर सी आई एम फ्रॉम अ मेडिकल बैकग्राउंड, आई एम एन ऑर्थोपेडिक सर्जन. तो होता ये है कि यू डोंट नो व्हाट काइंड ऑफ अ पेशेंट वॉक्स थ्रू द डोर,
Correct.
but they are coming with a problem. So as long as you solve their problem, you're giving them some solutions. You are allowing them to improve their quality of life, get back to that normality, whatever they enjoyed. तो उससे जो खुशी मिलती है, whatever happiness you get, that's what keeps me going, and that is the motivation of life as well.
So even I was talking to my wife yesterday night. So she told me, Abhishek, yaar, everything is a smooth life. What do you want? मैंने कहा, I want up downs in my life. So she said, why? मैंने कहा, I'm not getting kick off every day to going to office doing the same thing. So yesterday I thought about it. I will start one company called Air Bike Taxi. So I will start it today. After 5 years, there will be some companies, okay, and one of my company, one of them.
Fantastic.
So I choose that. So what inspired you to pursue orthopedics and later on build agile orthopedic services beyond traditional clinic practices?
See, this takes me back at least 2.5 decades.
2.5 decades.
So when I was in medical school, medical college, I happened to see a patient under guidance, obviously, because I was very junior kind of a medical student. There was somebody who had come with a broken arm, and we could see that the patient was in a lot of pain. And they were crying all over the place. There was a lot of uncertainty around them. Typically when somebody's health is disrupted, it brings in a lot of challenges and uncertainties. And then my senior colleague told me what was the problem. We looked at the x-ray. So the bone was broken, clearly.
Full broken.
Yes, it was broken. And that was the cause for the pain. So he said, give me a hand and we will help set the bone. It is called manipulation in medical terms. So we gave some anesthesia, we manipulated the bone and we put a plaster on that patient. And he said the patient will be fine. And he went away. So I was talking to this patient and obviously the pain got a little bit better. As I followed up that patient over the course of the weeks, it was very evident to me that every time the patient came, he was getting more and more better. And eventually it came to a time when the plaster was removed.
Right.
And we got him to have another x-ray. So I was able to see the before and after, and in whatever little part I could play in that patient's treatment, I could see that I had helped that patient. So there was somebody where they were in a lot of pain, the bones were broken, and at the end of their treatment journey, they were feeling better and they were on the road to recovery. And I had played a very small part in that. So that is what inspired me towards orthopedics. But over the course, see, I was fortunate enough to go to UK. I was part of that higher surgical training there in Cambridge. I got selected there. I was also able to pursue clinical research in the University of Birmingham. So I did an MD there. And to the point that we were discussing earlier, personal growth happens when you are out of your comfort zone. I know there is a cliche about this,
Right.
but the fact is my research work, see, I'm purely from a medical background. My research work was all about biomechanics. And I was looking at something called as helical shaped implants.
Helical shaped. What is that?
Yes. So basically, the rationale is we are all made out of three-dimensional structures and
As a human
three-dimensional
body.
helix. Yes.
Ah,
Your
okay.
DNA is a 3D helix.
Hmm.
So most of your bones are 3D helixes. So if something is broken, to fix that, you need a three-dimensional helix shaped implant.
Hmm.
So my research was into that. So in the course of understanding that, I had to learn a lot of engineering concepts, including something called as finite element analysis, where the stress builds up in the implant, what
Right.
kind of movement causes the failure, all these aspects of it. So I was completely out of my depth. I was completely out of my so-called comfort zone. But the thing is, if your intentions are good, see, you get the right guidance from the right people at the right time. So I
Absolutely.
had very good mentors at the university as well as my clinical supervisors. So I was able to navigate that. But the other advantage of that with the UK education system is it not only encourages you to learn about the know how, but also the know why part of it.
Correct.
It's
Correct.
that critical thinking, ability to work with multidisciplinary teams. Because as one individual, I can only provide one aspect of the patient's treatment or care. But you know very well that the patient's treatment journey requires a lot of specialties, a lot of specialists to come in.
Even emotional things is also required in
Absolutely.
for any kind of recovery.
Yes.
Right.
Correct. So as I started evolving and developing as an orthopedic surgeon, one thing I came to understand is technology is one part. So I could do most of the kind of so-called advanced procedures or surgeries, including robotic joint replacement and other things. But it doesn't contribute in the long term to what we call as the musculoskeletal well-being of the patient. See, why do we take treatment? Why do we do everything? To be 100% of ourselves 100% of the time, right? So that is the so-called well-being, right? And if you're not able to achieve that, then that means there is something missing there. And when I dealt a bit more deeper into that, so the current kind of orthopedic model of care that we have, I found that a lot of it was not integrated.
Correct.
So if you look at the current structure now, the diagnosis happens in some infrastructure, the treatment, and most of the treatments are very advanced, as you know, right? But they're happening at a different location.
Right.
And when it comes to rehabilitation, it's very disjointed. But if you look at it from a patient's perspective,
Hmm.
a lot of this has to be integrated.
Correct.
That means for your right condition, the diagnosis has to be done at the right point of time. The correct treatment has to be initiated by the right specialists or the team of specialists. And also the follow through is required to measure the outcomes of that treatment. Only then you will have that integrated care model. And that was the main focus for me as a professional, but also as an individual. How do I contribute to the best outcome for the patient?
We will talk about all these things, sir, like patient's recovery model, like why you get so much involved into this field. Okay, but before that, you have already got training in UK, Australia, and Europe, right? So how it is like shape your perspective on modern orthopedic care?
Yeah, a very good question. See, one thing, as you know, as you travel, you explore, you understand different healthcare systems, there is something for you to learn from every single kind of a healthcare system.
Hmm.
And most of the things when I worked, whether it was in the UK and then later on in the other countries, as you mentioned, each of them has a certain integrated care model, which works very well at a society level. And that is what has been my motivation
Okay.
to try and adopt those what they call as best practices or the best standard operating practices or SOPs to try and see how we can provide the best and consistent care for patients.
Wow. So what is the major difference in India and foreign countries in healthcare and orthopedics? What is the major difference you have seen?
See, one of the things that you'll immediately notice when it comes to the kind of orthopedic care that is there in India, the number of patients that are there is really massive because of our population. So anything in terms of healthcare model that you want to design, develop, you have to think about it to be scalable. Unless and until it is scalable to reach the every segment of society, it becomes very, very difficult to keep it going in the long term.
Correct.
One of the things that you see with the kind of healthcare models outside India is a lot of them have been structured. They've all been built on certain evidence-based practices so that the consistency is there. The quality is given to every patient irrespective of where they are approaching for the treatment. So just to give you a simple example, if you end up with a broken ankle or a broken wrist,
Hmm.
whether you go for treatment in Delhi or you go to maybe in Darbhanga, the treatment quality should be the same so that the outcomes get better.
But it's
And
not there.
that is where the challenges are. And equally, see, with every challenge, there is an opportunity as well.
Right.
So that is what we need to explore.
So was there a moment in your career when you realized that healthcare needs innovations beyond hospitals?
Yes, yes. As we were
What was that
discussing
moment?
earlier, see, when you look at patients, I'll talk to you about simple examples in my own day-to-day practice. Patients come to me for severe musculoskeletal pain or joint pain, typically from arthritis. And one of the treatment options that you offer them is like a joint replacement surgery.
For
Right.
arthritis patients.
Yes.
Majorly the arthritis patients.
Correct. For end-stage arthritis, where other treatment options have been explored and they've not been very kind of beneficial in giving them good pain relief, you then think about joint replacement.
Joint replacement, you are talking about joint replacement, knee replacement, and knee replacement, elbow replacement, and all. Yes, everything.
Yes. So any kind of a joint replacement, as a surgeon, see, you see them for that episode of care, right? And you do the operation to the best of your ability, and the patient is quite happy. But then what happens? They get discharged, right? They go back into their home circumstances, that community circumstances. What happens to them there is very, very critical. If they're able to get the consistent quality of care, let's say in terms of rehabilitation, what we refer to as physiotherapy exercises, there the outcome can be very good or an average outcome. And that is what has been driving me in terms of thinking beyond the kind of hospital setting.
Correct.
For making sure the patient outcomes are best all the time, as far as possible.
But it is not happening as of now, right?
Yes, there are a lot of, as I said, the silos of excellence, because you do see that patients are getting the best quality of care in certain segments. But when it comes to the continuum of care, see, you started this conversation saying life has a lot of uncertainties.
Right.
Right. It has a lot of challenges.
Yeah.
So to navigate those challenges for the treatment journey also, going from point A to point B, where the patient feels that they've recovered from that condition,
Correct.
a lot of guidance, help, and support is required throughout the journey. And that is where the challenges are, because a lot of that integration has not happened. And at system level, we need to provide those integrations.
So, sir, as of now, you are most demanded orthopedic surgeon in the country. You are a successful person as of now. So, you tell me, sir, like from your experience, how can studying in UK open global career opportunities in healthcare for any kind of a student?
Yes. See, one of the things, again, I'm reflecting back on my own personal journey here, is in the UK, the healthcare education or medical training, as well as the university route of higher education, be it in terms of clinical research, is very structured. But there are a few things that the system itself encourages there. When I say that, it is evolving around critical thinking, evidence-based decision making, working in a part of a multidisciplinary team. How do you communicate with each other? Okay, so that whatever the objective or the task is in front of you, whether you're a team member or eventually you become a team leader, what really matters is the objectives are met. Okay, and this is the kind of institutionalized kind of training that you get. So personally for me, if I reflect back on my journey, see, as far as the medical training is concerned, I started off in the junior roles there in the national health service sector. And as I evolved, I became more and more senior in terms of responsibilities. But then you start leading the team. Okay, so you need separate sort of skill set to manage a team. You lead a team as well, so you can understand.
Yes, right.
How do you delegate work?
Right.
How do you make sure that the tasks are done in a correct manner?
Absolutely.
And keeping the patient safety and patient outcome at the core of whatever you're doing. So these are the kind of things that the UK health system, the medical training, the clinical research, what happens in the universities there, is able to provide. And that for me has been very valuable.
Give me one example, sir, like when you started, like how was your journey? Then you evolved. Then after that, you become a team leader. How was that mindset has been shifted?
Yeah, very, very useful question, because it takes me down the memory lane as well. See, when I landed there, it was more than 2 decades ago. Okay, and I had to navigate my way as a part of the training there. See, for me, the challenges were two. I not only wanted to develop my skills as an orthopedic surgeon, but I had a lot of urge to do some kind of clinical research.
Correct.
Okay, so I had to develop both my academic career as far as clinical research is concerned, but also work as a full-time doctor,
Right.
learning orthopedics, going through the higher structured training there. So initially when I started, I was in a junior role. That means you do a lot of work, but you're doing it under the supervision of experienced doctors.
Colleagues talk to each other for any kind of
Yes.
problem they are facing or you are
Yes.
facing.
Yes. So one good thing about there is you get a mentor and a clinical supervisor. As a junior doctor, you're going through the training structure there. The beauty of it is there is a lot of reviews that happen, wherein typically it's called as an appraisal, but you can discuss a lot of issues that you're facing. Maybe it is medical or non-medical as well. So overall, in terms of student well-being, employee well-being, there are a lot of mechanisms in place there which makes you feel valued. That is what encourages you. And whenever you get a thank you card from your patient, that drives as a motivation as well.
So your mindset got shifted every time when you become a junior, then middle,
Yes,
and the senior person.
exactly. And as you go through the middle rung of the training, especially in orthopedics, you do the job roles called as a specialist registrar in orthopedics.
Register.
Yeah. And then you become a consultant. So as a consultant, then again, you have a team in front of you. So see, as a surgeon, you do a lot of surgeries and operations. One thing that happens there in the UK, which is very consistent, and I've adopted that in my practice, is something called as a team huddle. That means before we start a busy day in terms of our operating theater, whatever procedures are lined up for that particular day, all the team members meet right at the start, at the crack of dawn. We go through the list of patients that are coming in, what operations they're having, and we make a plan and say, okay, do we have the right kind of skill set? Do we need any additional help? What are the implants that we are planning to do? Are the logistics taken care of? See, at the end of this, the whole idea is to provide a care for that patient in a very safe manner.
Correct.
Okay, so if any kind of limitations are there, then we are able to discuss in an open environment. And that again comes with leadership skills because, you have to delegate, you have to time manage, you have to prioritize.
Right.
So all of these, what are called generally as soft skills, is very valuable throughout your life. But you are able to imbibe them, observe and learn from your senior colleagues as you go along in that
Correct.
system.
Are you an introverted person or?
I would say I'm not, because right from my school days, I've always been very, very talkative. And I think it is very obvious in this conversation as well.
So which was the first case you have discussed with your colleagues when you were in the middle age?
So, see, what happens there is when you look at any patient, there are structured protocols. So, the moment you see somebody in casualty, you do the initial basic, what is called as the emergency treatment for them. But then you have to develop what's called as a definitive treatment plan.
Okay.
So, one of the things that would happen, especially for orthopedics and trauma there, is whatever patients come in, their x-rays get discussed at the next following day. And we used to call that as a trauma meeting. Okay. So during that x-ray, you look at what aspects of the patient has contributed to that injury, what will be the kind of definitive treatment plan, and you then think about implementing that plan. So this is done day in and day out. And you do this for 2 decades, you can understand the kind of ethos it develops in you.
So when you came back to India again?
So I came back in 2021, right after the COVID wave.
So again, in India, as you already told, the massive population is there, or injuries are there, right? Or inactive lifestyles.
Yes.
We already talked about this arthritis. This is a common disease as of now in Indians, right? And the sports injuries are happening so frequently.
Yes.
So how is the demand for orthopedic care evolving today?
Yes, it's a very important question because, see, there are a lot of things that you can look into this. Orthopedics, on the surface of it, if you look at, okay, there is a diseased joint or a broken bone, you fix it and it gets better naturally. That used to be the thinking some decades back. But what we are now evolving is into something called as biointelligence. Okay, what I mean by biointelligence is if you look at most of the musculoskeletal problems, how do they manifest? Okay, you have either a back pain, a joint pain, a neck pain, something related to musculoskeletal. Pain is very central to that. Okay, so the moment it starts, there are usually 3 things that one has to look at. One is the movement, because there will be some limitations to movement.
Correct.
But that is coming from some level of metabolic dysfunction.
Hmm.
And that feeds into the lifestyle factors or the lifestyle choices that you make.
Correct.
The type of food that you consume, when you consume, how you consume. So the food you eat today is what you become tomorrow. Right?
Absolutely.
So this is something which delves into the metabolism. And the last but most important concept is something related to mind. Because see, everybody is in stress, right? So when you're at the peak of your stress, you're not your 100%.
Right.
You end up feeling very fatigued. You're not able to concentrate. You get that kind of muscular lethargy around you.
Right.
So this concept of biointelligence is something which is evolving and something which I have been working on. And now that we've got multiple kind of large data sets coming in, there is AI technology that is available. So going forward, you asked about how orthopedic care will evolve. I think it will evolve around this biointelligence concept. Biointelligence
Okay.
concept. Because up until now, we were able to provide precision care. You talked about robotics earlier in orthopedics. So we are able to provide very precise kind of things. So if I'm able to plan a robotic joint replacement for a patient, we achieve something called as sub-millimeter accuracy. That means if I position an implant on the CT scan, I know exactly when I'm putting it in the actual procedure or surgery, it goes into that position itself. So that is the precision part. But now we are evolving into predictive kind of a model.
What is it?
So let's say if I'm looking at Mr. Abhishek here, you have a certain biology associated with you, you have a certain musculoskeletal system, you have a certain joints, but equally with that comes certain biological markers. Okay, that can be your blood parameters, it can be a couple of other parameters as well. And then if you have, let's say, a certain predictive model, that means you adopted a certain lifestyle in terms of the food you intake, the kind of musculoskeletal activities which are programmed. It could be an exercise session, it could be a yoga session, it could be a meditation session. So all of this evolves and it then decides how your body responds to those environments. Okay. So the food that you consume, the water that you drink, as well as the sunlight that you enjoy and the air that you breathe, all of this has a powerful impact on our body. And I think this biointelligence is getting to a level where we are able to predict that. So from a precision driven care, you're going down the technology route to try and see if we can able to predict a lot of these things. So let's say if I initiate treatment A for you today, what will be the kind of outcomes? And if I initiate treatment B for you today, what will be the kind of outcomes?
Yeah.
So we are getting into that interesting phase. And I think that's where both the challenges as well as opportunities lie.
So I'm just assuming that there is a lot of opportunities for upcoming doctors,
Yes,
orthopedic surgeons.
Yes.
Right. So India needs that.
absolutely.
How many orthopedic surgeons India need?
Well, see, there isn't any fixed number that you can
Example,
think
like
about.
on the 1,000 people, there should be one doctor.
Yes.
Okay. So how many orthopedic surgeons should be there in India?
As a general rule of thumb, if you look at it for 1,000, you need at least, I would say, about 100 or so. The reason being, you are not looking at one orthopedic surgeon doing everything. You are getting what we call as subspecializations as well. That means if you look at some of my colleagues, some of them are very good at spine procedures. Some of them are very good at sports injuries. Some of them are very good at joint replacement procedures. So you need a diverse skill set to be able to provide that continuum of care that we were discussing earlier. And not only that, you also need people to be able to absorb that technology that is coming in, because we live in a cusp of an AI revolution, as
Right.
a lot of your previous guests have highlighted. You yourself are aware of it. So how do you leverage those technologies to make the human life better, but also for patients when they're going through this kind of difficult journey, how do you ensure that those outcomes are good? And I think that is where AI and other technologies can be very beneficial.
Wow, sir. So in this podcast, the very important question now for all the students who are looking for to become an orthopedic surgeon or want to go to UK, US, correct?
Yes.
So for Indian students aiming to study in UK, especially in UK, which scholarship are actually accessible and impactful as of now in 2026?
A very practical question. See, one of the things as a student is you're always curious. People want to understand where the opportunities lie. And UK, from my personal experience, I can tell you, has plenty of opportunities. And through the British Council as well, there are a lot of initiatives that are being taken. And in terms of the scholarships itself, there are certain scholarships which people in India can apply for, and they can make utilization of those things. Some of them involve the Commonwealth Scholarship, the Chevening Scholarship, and the Great Scholarships as well. But apart from providing just the funds, they provide you certain networks. And in India as well, there are certain alumni networks. See, I'm an alumni. That means I have educated in the UK. I bring those skills here, but I'm trying to help people understand the ecosystem there and how do they navigate that as well. And facilitate and wherever provide that support kind of a mechanism as well.
So are you supporting
Yes.
any kind of student? You tell me truth.
Yes.
How many students you are supporting as of now after alumni?
You see, after becoming a formal alumni, I think I would say at least 1 to 2 student approaches me, and it could be very simple as well.
Right.
Like I can give you an example where one of my neighbor's colleague, he had done a very basic medical education in India, and they wanted to know what kind of opportunities lie there in the UK. And see, this day and age, there are multiple sources of information, as you know.
Right.
You can look at it online, you can go through print media, you can, listen.
But that is not authentic, right? Real people is authentic. I believe on the people.
Exactly the point. So it can be a random WhatsApp message. People pick up the phone and call me and say, I got your number from so and so.
Right.
This is what I'm planning to do. Do you think it is feasible?
Hmm.
Do you think I should do it now? And on occasions, I must tell you, Abhishek ji, that I have advised people to plan it a bit more better.
Okay.
Because it's very easy for you to think that, you can book a flight ticket and jump on the next plane and go there.
Correct.
But these things take a lot of planning. Okay. So as long as you have the right plan in front of you, the right guidance in front of you, the right opportunities also open up and you meet the right people to guide you for those things also.
Absolutely right.
So Abhishek, I want to add one more thing. So through the British Council, there are some initiatives. One of them is to do with women specifically.
Okay.
It is for people going there mainly through science, technology, engineering, and mathematics. It's called as the STEM initiative, and they support women through financial grants as well, and they can approach multiple universities for higher education. The other initiative through British Council is the pre-departure briefings, which is meant to give you some guidance in terms of how you can understand the process there, what are the kind of university structures that you'll be enrolling into, as well as they will get you introduced to the alumni network.
Correct.
So those are all the options available for the students who are planning to go to UK for higher studies as well as for clinical research.
There are two kind of orthopedics things services, like Agile Orthopedic Services and traditional hospitals. Okay, so what makes an integrated ecosystem like Agile Orthopedic Service different from traditional hospitals?
Very good question, and this is something which is very personal to me as well.
And why it is personal, you also share, please.
Yes. See, when I've been treating patients, as I said, currently the healthcare model is very much reactive and it is very much episodic. What I mean by that is whenever a person has some kind of an injury or a joint disease, that is when they approach a healthcare professional. Okay.
Correct.
And the healthcare professional, which is most of the time an orthopedic specialist or a surgeon, sees them for that episode of care. It
Right.
could be a joint pain, it could be some musculoskeletal problem, a ligament tear or something there. And then what happens is that episode of care is managed. Now, whether it is managed through what we call as conservative methods, which could be, your tablets, your gels and ointments, and maybe some exercises, or certain surgical procedures, which could be your ligament reconstruction or joint replacement and other things. But beyond that, what happens to the patient is there are a lot of challenges on the treatment journey part. What I mean by that is after the treatment initiative is done, okay, so that means your pain gets better after you take medications.
Correct.
Or you feel a bit stronger in terms of your ligament after the ligament reconstruction is done. But that doesn't mean the end of your treatment journey, because a lot of it relies on rehabilitation as well.
Okay.
Okay. And that rehabilitation is very crucial in terms of how your outcomes are going to be. That means I treat a lot of sports injury patients. I treat patients with background from cricket and from rugby and all that. And for them, the first person I introduce as a part of my team is my physiotherapist. Okay. And same thing with arthritis patients as well. So people, even before they come to see me for any kind of a proper surgery for that particular condition, they start off with my physiotherapist. They start something called as a prehab or a pre-rehabilitation kind of exercises. It's very well documented in the scientific literature that if your joint and your muscle are in good condition, whenever you come up to any kind of a planned operation or a procedure, your outcomes are much better than straight away diving into the surgery. Okay.
Okay, got it.
So, for this particular reason, the way I have tried to set up Agile Orthopedic Services is to follow the patient and have a patient centric care. So, from a patient's treatment journey point of view, whatever is required, we try and enable them and give them a roadmap in terms of 3 months, 6 months, 12 months. What would be the kind of journey that they're taking? It may not necessarily be with me, it may be with some of my team colleagues or some of my other colleagues who may not be based in Bangalore also. Okay. So, but what happens is that entire treatment experience for the patient is very much guided. They feel very much supported, and mentally also it is very reassuring for them that they know, okay, I've completed step 1, I'm now moving to step 2 and step 3. And that is what sets us apart from conventional orthopedic care.
So that means you are saying कि physiotherapist is playing an important or like equivalent role with the orthopedic surgeon.
Absolutely.
Correct?
Absolutely.
Huh?
And the way we were discussing technology earlier, see, one of the things that I have been working on is what is called as virtual reality based rehabilitation.
Okay, what is
Okay.
that?
So basically, what happens is you might have seen a lot of the VR headsets that come out now, which will help you provide what's called as a very immersive experience.
Correct.
Okay. Now, we have certain technologies which can be used for patients to do their rehabilitation exercises. See, after a period of time, it becomes very boring.
Right.
But tell a patient, keep lifting your hand this many
I
times,
will not
bend your
do.
knee. No. And we all know that if something is comfortable and convenient, only then compliance comes. If it is not comfortable, it's not convenient, you can't get compliance going forward. So what we've done is for those simple kind of exercises only, in virtual reality, you can make it as a game. These are called as immersive gamified experiences.
Wow.
Okay, so we've done a lot of rehabilitation, including patients with wrist fractures, patients with shoulder problems. So what happens for them is it becomes like a game. But the beauty of this technology is we can measure the metrics in terms of what is the kind of movement that that joint is doing, how many times the patient is doing, compared from week 1 to week 6, what has been the kind of improvements that we have seen.
Correct.
So it is able to generate a lot of that data through the sensors, and this data feeds into that biointelligence that I was talking about.
Really agreed with your this perspective of physiotherapist wala, because I will give you my example. Uh, I do horse riding. One day I fall. This elbow has been broken,
Right.
full broken. So doctor told me you can't do straight your hand.
Yes.
Okay, so it's now not there. But he told me that Abhishek, you do after a physiotherapy, you have to do physiotherapist after that. Matlab, you have to go to physiotherapist and you have to do all the things. But I have ignored him. So now my hand is not moving like this. Like after the operations and everything, so you have to take care of your body for certain time.
Yes.
Correct.
Yes. That is very crucial. That is very, very crucial. And it's a very good example that you've highlighted. See, through you and through your audience, I would
Correct.
like to highlight that the rehabilitation part, which most of the patients don't give much importance towards. They feel like, okay, the surgery is done.
Right.
I've done through most of my treatment part. It becomes like they've completed 70 to 90% of the treatment. But that last crucial 10%, which is where your lot of dedication and
Yes, right.
motivation is required, is also equally important.
I am the right example for everybody.
Very nice.
Wow, sir. So let's talk about some business perspective. Okay. So what are the biggest challenge in scaling specializing orthopedic services?
See, one of the things that I have realized, especially after moving back to India, is when it comes to orthopedic care, consistency in quality is very crucial. And a lot of it depends on two major things that we require. One is good quality infrastructure, and the second is the manpower that will manage, run, and hopefully evolve that infrastructure as well.
Correct.
So, if you look at infrastructure, it doesn't necessarily mean just big buildings and hospitals. It also means the technology that is embedded into those places. Because from a patient perspective, whatever the infrastructure is there, it provides one element of that care.
Correct.
But then the people who are there, who are providing that care, those treatment, those services, also are very much important. And in terms of business challenges, as I mentioned earlier, because of the scale at which India operates, the challenges and equally the opportunities are enormous.
Correct.
So wherever that infrastructure development is to be done, it has to be done in a thoughtful manner,
Right.
so that it can reach all segments of the society and all geographical distribution of our population. But equally, the manpower in terms of the skill, the experience, and also the attributes that are required needs to be developed in parallel, not sequentially.
Right.
See, if you look at my own experience, I can tell you it took me almost 2.5 decades to realize that I'm only a small cog in the wheel in terms of the patient's treatment journey, right? But the fact is, it takes somebody and a system 2 decades to get a well-rounded professional.
Right.
Okay. So you can't think of any kind of a business scalability model if that aspect of your business in terms of manpower, skill, and development lags behind. So infrastructure is fairly easier to put up. You have the capital, you have the right blueprint, you can put up the infrastructure.
But are you facing any challenge for this supporting roles?
Yes.
Huh?
To a lot of extent, I will give you some simple examples. When I was in the UK, whenever we used to see the patient, we used to record on a dictaphone,
Okay.
that patient consultation as a part of your medical record keeping. And so the consultation would be done first. After that, you would then sit down, you'd record everything, and then it would go and that tape would get transcribed.
Oh.
And that was called the medical transcription. So when I moved back to India as well, so that was something which I was finding a bit of a challenge, because even though I could record it, there wasn't that technology that was available.
Yeah. Right.
But eventually what happened is artificial intelligence, especially voice recognition part of it, started becoming very, very good at predicting my own vocabulary. See, Abhishek ji, you have a particular vocabulary
Right.
which you will start speaking,
Right.
and voice recognition gets better with each iterative version. So I started experimenting around AI and tried to see if I can record some conversations. And lo and behold, it started getting better. And I started using it in 2021. So initially it was for patients with face-to-face consultations. Now I have done it for diverse group of patients where there is an interpreter, and I've done it for patients as far as Yemen as well. War torn Yemen. There are different people who are translating what I say into their local dialect, and the AI is able to recognize that. But at the end of our consultation, it comes up to the structured treatment plan. So all that I have to do is look at it and see whether there are certain minor tweaks and changes that I have to do. But it has done away with that kind of a laborious process and a time-dependent process. So why I bring this example is previously that skill requirement in terms of medical transcription
Right.
was there. But now AI has come in. So what we really need is people who are trained enough to utilize those AI technology and do the final tweaks and changes. And that is another additional skill requirement that will be there going forward. And we'll have to see how the industry responds to
So
that.
I think I have done one podcast. Somebody told me that we do transcribes for medical services in India. So there are so many work outsourced from US, UK to Indian people for the transcribe of the medical things, right? But now it's gone off, or due to AI, or still is there.
Yeah, no, I don't think they can be completely taken over by AI.
Hmm.
But a lot of the efficiency models can be built in using AI. Okay, so that is where the scalability part comes in. See, any technology brings with itself certain opportunities and challenges.
Correct.
It is us as a society in how we look at that technology and how we leverage those technologies and make them work with us rather than work against us.
Wow. So Dr. Darshan sir, one misconception you have to break today. Okay. So what are the some common misconceptions people still have about joint replacement surgeries?
A very important question.
Correct.
See, generally, whenever you hear about joint replacement, commonly people think that it is a surgery for the very old. It isn't like that. It depends on each patient's individual circumstances. And that is why I advise all my patients is look at your particular set of circumstances, talk to your specialist, and if they are advising that you need that procedure or joint replacement, then it has to be put in context.
Correct.
So the myth that only aged people require joint replacement is not valid. The second thing is people think that I do joint replacement and I'll be 100% normal. It doesn't work like that. So this brings me back to the point about prehabilitation, the exercises you do before surgery. That is important, because if you jump into any operation thinking that, oh, I'm getting the surgery with the best joint replacement surgeon on the planet, and everything will be hunky dory, or they call normal, and it isn't like that. So patient's participation is very much important, as much as the surgeon's skill and the quality of the implants and the infrastructure in which that procedure is being delivered. Okay, so this is the second kind of a myth. The third myth is that it takes a lot of pain and lot of recovery time. That isn't the case. See, one thing that has happened post-COVID especially is a lot of what is called as daycare joint replacement procedure protocols have been standardized. Enhanced recovery protocols have been standardized. In terms of anesthetic care, there are multiple advanced techniques that have come in, which enables the patient to mobilize pretty much on the day of the surgery itself. So this notion that a joint replacement surgery requires weeks together of hospital admission and then bed rest after that, they are all decades old.
Okay.
So these are some of the misconceptions that I have seen in my practice. There may be several other ones as well, but I'm open to discuss when patients come, and I try and educate them as much as possible.
Whatever we are talking, the ultimate goal is consultation is much better. You don't see the reels, you see the reels, you trust the people, you go there, you consult them. After that, you take any kind of decision.
This is a very important point, because we are now at the cusp of that inflammation
Correct.
explosion.
So much of information. So I keep telling to my audience, whatever I'm talking to any guest, okay, believe it, but don't too believe it. Okay, just go to that person, ask that whatever questions I have left it, you just ask like n number of questions you can ask them, and after that you got satisfied, then go for any kind of treatment or any kind of thing you want to consult with the particular person.
Correct. Absolutely.
Correct, sir. So what major transformation do you expect in orthopedic care over the next decades after 10 years?
Yeah, again, this is something which I have been working on. And what I personally of the opinion is that we will be eventually going towards a more predictive kind of a healthcare model in general, okay, where we are able to predict the kind of diseases, but also the type of treatments that we are able to offer, what will be the kind of outcomes that the patients will experience.
Correct.
As I said, if I give you tablet A, what will be the kind of recovery timelines that you can expect in terms of your symptom improvement? Or I do procedure B, whether only procedure B is required or you need certain additional things. So that is where the predictability part is going to come in. So in general, I think from just having precision medicine over the last decade or so, we are going towards a more predictive model in terms of healthcare in general.
Correct.
Now, specifically for orthopedics, as I said, I have been working on that concept of biointelligence, wherein you look at the movement of the musculoskeletal system, you're looking at the metabolism of the patient. And an interesting concept I just would like to add in here is most of the people don't make any association between their gut, that intestinal health, and joint problems. But one of the most modern concept is that your gut is very much related to your joint inflammation and arthritis.
Wow, new information again.
Yes. So this is called as the gut joint axis. So that means patients who have a lot of gut issues, gut related issues, most of them, they put it down as their own personal problems. It isn't. It is a very valid condition. It's called as gut dysbiosis. So if you have gut dysbiosis and you're not seeking professional help, then what happens is that problem festers on. Your musculoskeletal system in terms of your joint arthritis can deteriorate. Whereas these problems are very easily fixable. As long as you're seeking a professional help on the time, you will be able to get through these problems very quickly and you can rejuvenate yourself. So that is the other part, which is to look at the metabolism of an individual. And lastly, the mind aspect is very much, I think, underrated, and the impact it has on all of our musculoskeletal well-being. You know, we think about stress as something which is very abstract. It has very finite, implications in terms of your own energy levels, how much fatigue you feel, how much productive you feel on each day. And I think the three kind of components is what I've been working on to build that kind of biointelligence model. And yeah, it's a wonderful journey. Let's see how things evolve.
Every generation look up to those people who have done something, right? So already you have given 2.5 decades to the society in orthopedic field. So everybody, those who wants to become like you, okay, for those people, So, what advice you would like to give to the students in healthcare or research considering students in the UK?
See, for most of the students now, the access to information is phenomenal
Right.
compared to what it
Wonderful.
was 2 decades ago. But then it comes to the point of where the credible sources of information are.
That is more important point, right?
Absolutely. So specifically when it comes to the UK, trusted sources like the British Council and their initiatives is what I would suggest to most of the students to reach out to them, because there are a lot of avenues where you can get the correct guidance,
Correct.
the correct time, as well as use those opportunities going forward. But in addition, see, we live in a lot of turbulent world now. Okay. So certain amount of mental resilience for students is also very much important, because you might have seen a lot of students take exam outcomes in a very stressful manner. They prepare for an exam and there's a lot of kind of hype that builds around the outcomes of the exam. And when the outcomes are not as per your expectation or your family's expectation or your friend's expectation, it becomes too much of an emotional kind of a burden.
Right.
So that resilience is very much important, because if you have that resilience, then irrespective of what the outcomes are, and especially if you are planning to go abroad to a structured educational system like the UK, you will have those support mechanisms there. But equally, see, we were starting this conversation with uncertainties.
Same.
So it all boils back down to the same point that uncertainties will be part of your life. So if you have that resilience and remain curious, because we all learn every day. There are so many things that I've learned from you today, okay, in terms of organizing and managing a team, that you learn every single day. So if you're curious, then that learning journey never stops.
Correct.
Okay. So the last aspect of it is for the parents. See, I'm a parent myself. So whenever your child says that I want to go abroad, specifically to a country like UK and learn new things there, it does bring in a certain element of uncertainty for you, because you don't know where they will be, what they will eat, what kind of a friend circle they will interact with. But I want to reassure the parents that in India itself, through the British Council, as I said, there are a lot of initiatives that they can go to. They can get the correct guidance, as well as the scholarship that we've discussed. There are multiple options available so that they can sit together with their children, make a plan, and help them provide those kind of opportunities. Because one thing with any kind of a talent pool that we are developing in India is this global exposure will be very much important.
Right.
Because the other aspect of the UK system is that now there is the graduate route which has been initiated, which means that for students post their education, whether they're doing a bachelor's degree, a master's degree, or a doctorate level PhD as well, there are certain agreed time periods that the system allows you to seek career work opportunities, and that real world experience that you can gain by working in an ecosystem like that. It's phenomenal because it can open doors for you globally. Wherever those skill sets are required, you have that ability to go there and make your career and build those career paths.
Done. So you already spoken about British Council, but still I would like to ask one more question for British Council. How can organization like the British Council support the student pursuing healthcare education abroad? Again, you need to elaborate it and give me 3 USP of that.
Okay. See, one thing with the British Council is that it is a professional body. So whatever guidance you get from them is very valid,
One is guidance.
very current one. Okay. Second thing is creating opportunities in terms of scholarships. They will be able to help you apply for those scholarships,
Correct.
because a lot of those education brings in certain financial challenges as well. So if you're able to fund yourself for part of that education, then it takes that kind of financial burden away as well. And lastly is being able to reassure the people around you as well.
Right.
That is where these initiatives, where that pre-departure briefings come in handy, because it is not just the children or the student that they are catering to. They're able to speak to the parents of those family and give them some reassurance. And if you know what would be the kind of path that your children are going to take through in terms of the universities there, and what will be the opportunities that will open up for them there, then I think that is where a lot of that British Council's initiatives are very beneficial.
Absolutely right, Dr. Darshan. So I would like to end this podcast today with one very great things: trust and deployment. Okay, so you have to trust somebody first thing. So as you told me, na, ki Abhishek, how you are managing your team. So at 12:30, I had a meeting with very big company, like India's top company. Their head wants to take a meeting with me. So I thought, okay, I told but my team that I have a podcast. I will be not available. You take it. Either you can won it or you can lose it. Doesn't matter, but you will learn it something. So there is a deployment and there is a trust. So if you are going abroad, you have to trust the trusted source and the authentic partners. Correct, Dr. Darshan?
Absolutely. I think very nicely put. And it's been a phenomenal conversation, Abhishek ji. And thank you for having.
Thank you so much, Dr. Darshan, for coming here in the podcast. Thank you.